So here is our liver demo for the day. So this is the right lobe here. It's a little bit bigger than the left lobe. So this pipe cleaner is just separating our lovely bag of cotton balls. So the liver is a very dense organ and it sits right underneath the rib cage. It actually comes up relatively high, up around the 7th rib. And it functions by, within the rib cage here, it moves forward and back. It rotates this way, not that big, but you know what I mean. And then it also comes up and down this way. And so in order for the liver to function properly, it requires that movement. So that's what that movement is, what creates the good physiologic motion. And so as it's sitting here, the way that we can actually lose movement of the liver is if we look at, there's over 500 functions of the liver. And so any type of inflammation, infection, if you're overloaded with toxins, whether that's medication, something in the environment, mold exposure, inflammatory diet. Sometimes this area will get really restricted with pregnancy as the belly is expanding and growing. So there's a lot of different ways that we can look at how the liver loses movement. You can also look above the liver where we have the lung and the heart. So if there's any type of asthma, inflammation of the lungs, myocarditis, area around the heart, any type of surgery or even just impact to the sternum can throw the liver off, and it's gonna do that by a couple of different ways. So if we look at the lung and heart issues, the diaphragm sits right on top of the liver, and so every time we inhale, the diaphragm contracts and drops down and creates this good movement of the liver. That's a part of the movement there. And so what happens is if the lungs and heart can't drop down with the diaphragm because they're inflamed and restricted up here, the liver can lose movement too. And so that's how that ties in together. The other thing is if we come back to the impact to the sternum, the liver is a super dense organ. So it has a lot of different ligament attachments that are supporting the liver, but if there's an impact to the area where the liver is, whether it's to the sternum, whether it's to the side, contact sports, car accidents, fall skiing, it tends to, just like the brain and skull would have with a concussion, it's such a heavy organ that it bounces around quite a bit, and so it can get physical trauma to it, and sometimes there's stored energy in that if we go back to physics. And so if it's hit against the rib cage, that can create that tension that then limits the liver function. So if we look, those are kind of an example of some of the different ways. Hormones. Hormones is another big player of the liver. And so if there's any hormonal dysregulation, that's another cause of loss of motion here. So looking at why the liver needs to move, how it can lose movement, and how does that present. So what can happen, kind of like I was talking, we can lose this diaphragm natural breathing rhythm. So people will have trouble breathing well. They might have a little bit more anxiety because they can't have that smooth diaphragm motion. But then you can also start to lose some of these good hormone functions, digestive functions, ability to detox, congestion in the bowels, so constipation, that's a big one. You can also, so I'm gonna leave the liver there. So as we move, as Betty moves her arm, this liver also needs to be able to move. When Betty is sitting at her chair and needs to rotate to grab something, her liver also needs to be able to move. So when we look at all those different reasons, different causes for loss of movement, someone can also present with issues there, maybe a rib that continues to pop out, a shoulder pain, something like that, maybe even traveling up into the neck because this rib cage thoracic spine needs to be able to move. Maybe she even starts to have breast congestion on that side. So those are some of the things that people can present with if the liver loses movement. And then how do we improve movement? So we've assessed Betty, and her body is telling us the liver needs to work first. So a couple different ways that we can do that is there's only a couple of spots where we can directly or have a better, like not through the rib cage, a better contact with the liver. So that's either with her laying down or seated, and we can come underneath the rib cage here and assess how well it moves in different angles and work different blood vessels that way, different ligaments, have her move in different ways. So that's a good way when we come kind of underneath this rib cage here. We can also, working through the rib cage, assess those planes of movements that I was talking about. So we can check, is it rolling anterior, posterior? Is it rolling medial, lateral? Is it moving superior, inferior? So when we're here, we're checking those movements to see how well, maybe it has an adherence to the lung here, and we can work those two organs together. And then another way that we can work it is something we call viscoelasticity. So the liver really loves compression and decompression, I should say. It doesn't love to just be compressed. But through compression and decompression, we can actually help stimulate the cells and improve function, which is super cool. So there is a technique through the ribs again, where we can kind of gather the liver tissue as a whole and do a little bit of compression and then follow the decompression and do that a couple times and just help stimulate the liver as a whole, stimulate the metabolic center, which is right where the gallbladder is on the liver here, or tucked into the liver here. So that's another way that we can really help the liver, and that's what we actually use a lot of core disc ball to teach people how to do that in a similar way on their own. And then lastly, another important one with the liver is we've got the stomach sitting over here on this left side. And so oftentimes what will happen, the liver kind of ends right here, there is a tissue called the lesser omentum that goes from the liver to the stomach. And a lot of times that area can get adhered as well. And so we can do it when they're laying on their back, but usually in a seated position, and be able to offload that area so that the liver again can move freely. And then homework wise, a big one for the liver is in different positions, we want to assess how Betty, now that the liver is moving, how well she can breathe. So can she breathe in a 360-degree direction? And we don't want to force that breath. So the inhale is what's really moving that liver down. But if that liver's been stiff for so long and she has to forcefully inhale, that can sometimes rev up someone's nervous system and not really be productive. So sometimes we'll do what we've talked about, this reverse breathing. So exhale, focusing on a really long exhale and just letting the inhale do its thing on its own. And so naturally retraining the diaphragm, which is a muscle, to encompass that movement. And then of course, just homework, making sure if they need more detailed testing that they have a functional provider that can help with that. And that provider can also talk through nutrition and that kind of stuff. We talk a lot about environmental toxins, what water filter you're using, skincare products, what cleaning products you're using in your house, how clean is your air. So breaking down different ways that Betty could be absorbing an excess of toxins and causing her like toxic load bucket, the capacity for her body to handle toxins, to overload. So lots of different cool ways that we can help the liver, and hopefully that's helpful just to kind of understand a little bit more about what visceral manipulation is, vascular manipulation, neural manipulation, all the manipulations, all the gentle and specific manual therapy that we do. Stay tuned for the next organ.